Can quitting cannabis reverse cannabis-induced psychosis? Have you ever wondered if stopping cannabis can help someone who is experiencing cannabis-induced psychosis? This is an important question, especially when we consider its connection to schizophrenia and first-episode psychosis. Schizophrenia is a serious mental health condition that affects how individuals think, feel, and behave. It often involves symptoms like hallucinations and delusions. Cannabis-induced psychosis can occur after using cannabis and is marked by symptoms that resemble those of schizophrenia. This includes hallucinations, delusions, and disorganized thinking. The risk of experiencing this condition is higher for people with a personal or family history of mental illness. Adolescents are also at greater risk because their brains are still developing. In many cases, cannabis-induced psychosis is temporary. Once the cannabis is out of the body, the symptoms often resolve. Quitting cannabis can help relieving these symptoms because the psychotic episodes are usually triggered by the active compounds in cannabis, particularly tetrahydrocannabinol. However, it is essential to consider that for some individuals, especially those with a genetic predisposition to schizophrenia, cannabis use may trigger or worsen underlying mental health issues. If cannabis use is contributing to psychotic symptoms, stopping its use is a vital step in managing these symptoms. While quitting cannabis can reverse the immediate effects of cannabis-induced psychosis, it may not prevent the development of schizophrenia in someone who is predisposed to the condition. This means that while someone may feel better after stopping cannabis, they could still face challenges related to schizophrenia later on. For those dealing with cannabis-induced psychosis, seeking professional help is important. Counseling or therapy can address any underlying mental health issues. Avoiding cannabis use is also recommended to prevent a recurrence of psychotic symptoms. Early intervention and support from healthcare professionals are essential, especially for individuals who may be at risk for schizophrenia or other mental health conditions. In summary, quitting cannabis can help reverse the effects of cannabis-induced psychosis for many people. However, for those at risk of schizophrenia, it is crucial to seek additional support and care.